Hello. I'm pretty certain I've already been introduced, but my name is Fiona. I am a patient of Dr. Baverstock's in Calgary, Alberta at the Rocky View um, Hospital. He is the doctor that does my Botox. He's been doing my Botox since 2009. It has only been the last two sessions that have not caused me to become ill. This is due to my um, malignant form of multiple sclerosis, and my my bladder ran my MS, and so every time I would get a Botox between 2009 and 2011, I would end up with a UTI, and then I would end up hospitalized. I would end up paralyzed, and then I would end up with an indwelling catheter, and so it really all defeated the purpose. Since my transplant, I had a bone marrow transplant, stem cell replacement for malignant multiple sclerosis with Dr. Atkins and Dr. Friedman in Ottawa. And I, since then, have had two bladder Botox, and they have been heaven sent. Um, I, for the first time a couple of weeks ago, started going to bed without a diaper for the first time in 7 years. I no longer need to wear pads at nighttime. I am pretty self reliant at this point, and coming from a girl who was a quadriplegic, and my autonomic system was shutting down, and my smooth muscles were not working at all, and that does not happen for me anymore. And since my last Botox, which, pardon me, was the 7th of September, and like I said, I have been diaper free, and that has not happened in many years. The procedure itself um, certainly gets your attention. You go to the doctor's office and they take you into a room. You change your clothes, then you go into this room. Then they lay you down on the bed and they strap my feet down. And because when they stick the needles in, my legs will go into spasm and I can kick them. Um, so they strap you down and then they put on an anti or topical freezing cream, and that stays on for about 4 to 5 minutes. They'll cath you to drain, make sure your bladder is emptied, um, and then from there, Dr. Baverstock comes in and he puts a little light with his needle. They put in 20 shots of Botox into my bladder. I have no idea what they do with other people. Um, and from there, when you first walk in, I'll go back a little bit because when you first walk in, they give you an antibiotic called Cipro, and it's to prevent the urinary tract infection, or try to. Uh, Now it works for me. Before the transplant, it never did. That simply is because my body was so ornery, and I just hope that it is my hope that in Ontario that doctors start to do this, because for patients with incontinence, there is no greater blessing, and it's freedom. And for anyone who knows um, how embarrassing it is to wet your pants or overflow a diaper or avoid leaving the house for fear um, of one of those things happening. Um, Diapers are wonderful as far as they go, with the exception of when you sit. Um, when I was in a wheelchair and laying in bed, or when I'm laying in bed, it was never bad because it fills your diaper. But when you're having to sit up, a diaper only holds so much fluid, and then you have it coming down, and it's just a mess. And people are afraid, and they don't want to leave the house. They don't want to be embarrassed or ashamed, or and it's horrible to be that person where you can do nothing about where you're at. And incontinence with multiple sclerosis is hardwired, and it's difficult for anyone to be okay with what is happening. And so for me, I had only been diagnosed a year before I was in diapers. Like I said earlier, I've been in them for 7 years, and it's only now been 2 weeks. And for me, there's no freedom. There's no freedom like it. And I still catheterize to go to the washroom. That's how I have to go because my bladder does not empty properly. And so, for the freedom of not getting UTIs and all that stuff, I catheterize 5 to 6 times a day, and I don't need to protect myself anymore, and it's just wonderful. So I hope, I don't know if this is what you need to hear. Um, I'm not sure if I have filled you in on enough information. I just know that this is my story, and that Botox is freedom, and freedom from MS for an MS patient is hard to come by. So this is just one stepping stone to a better life, and so for me, it has done countless good things. So thank you very much for your time, and I hope you have a wonderful meeting. And uh, I'm coming to you from Alberta, and I'm just really grateful that I can be here to help. Thank you for your time. Have a great day.